This is NNI Bites, Big Learnings, a podcast where fellow healthcare professionals share conversations on nutrition science's latest. We are joined by Professor Gary Wong and Professor Nikos Papadopoulos as they share their knowledge and insights on how the pandemic shapes the future of allergies.
Welcome, everyone. This is the NNI Bites, Big Learnings, a podcast with the topic of discussion today is how does the pandemic shape the future of allergies? And our guest speaker today is Professor Nikos Papadopoulos from Athens, Greece. Welcome, Nikos.
Thank you. Hello, Gary. Thanks for having me here at NNI Bites, Big Learnings. Greetings for sunny Athens. And I really look forward to this discussion. I think it is very interesting times. We're just coming out of the COVID pandemic in a way, and we have some learnings, but also we need to look ahead. So I think it is really timely to have this discussion and see what the future is bringing to us in relation to allergic patients.
Right, certainly. Over the past few years, there has been a lot of changes, particularly regarding our practice in combating the pandemic. And some of these measures may have exerted a major influence on the immune system. So may I start with the very first question related to this topic? From your point of view, what was the impact of COVID-19 pandemic on patients with allergies, such as asthma?
Yeah, so this is an important question. Of course, you understand that it is a little bit more complicated than that because we have different types of patients. And some of them, the ones that had more severe allergies, severe asthma, they had an increased risk for complication. But this was only a small part of the problem. The big part, in terms of the very wide proportion of the population that has allergies, a lot of patients, in fact, they did not have so many problems. And there are some indications that allergy may have been even protective against SARS coronavirus infection. And we have tried to explain that by suggesting that the main SARS receptor is reduced in allergics. So this can be a reason that they had less clinical problems. However, this goes much beyond biology because the behavioral and the social changes that have affected, that have increased the impact of COVID were actually very high on this population and in every other populations. So the allergic individuals were also locked down together with all the rest of us. And so they avoided exposures to different allergens, but also they avoided exposures to common infections like a rhinovirus infection, for example, that usually trigger asthmatic symptoms. So as they were also afraid of the consequences, they started taking the medication. They started to be compliant. And we know that usually patients are not very compliant, but during that time, they were very compliant. And as a result, we have had a significantly reduced impact of terms of allergies and asthma in these patients. And of course, healthcare systems have changed. They had to adapt. And because the allergics were not such a high risk of death, they kept them a bit of a distance. They didn't want to come to the hospital. They were not allowed to come to the hospital. So on one hand, the services had to be reorganized. But on the other hand, there was a big development of telemedicine. So we have, the plus and the minuses. Now we have a significant change. And this is during the last year, the last season, where we came out of the lockdowns and we see a significant increase of all respiratory infections all across the world. We have more and we have more severe infections. It's a comeback. And we explain that because we have not been exposed as a community to these different viruses to small extents, but now our immunity is not ready for them. And this affects also the allergics and the asthmatics. We don't know if they're affected more or at the same level. However, we do see these infections, and this is, of course, ongoing. So we don't really know what will happen this year or next year, but we really need to be vigilant.
Yes. I'm glad you brought up the measures that we have used over the past 2 to 3 years in combating the pandemic. and in particular with the social isolation and reduction in exposure. So what do you think of the hygiene measures that we have used during the pandemic? Will that sort of practice have long-lasting effect, particularly on the young children, those like under 5 years of age, in terms of their future risks of allergies?
Yeah, this is an important question, an important consideration. And for people to understand the context, we need to say first that there are several important events which are related to the maturation of the immune system that happen early in life. Also, the microbiome matures quite early in life. So it is reasonable that if something disrupts this maturation process, it might have an impact. And so there is a hypothesis, there is a suggestion that children that were born during this time, but also young kids in general, may be affected to some extent. They have been affected, of course, as I mentioned before. They did not have infections in the beginning, the first year or two. Then they started to have more infections in general. But we don't really know. There is a possibility that they might be affected for the future. On the other hand, we know that human homeostasis is really strong and it's capable of balancing things. So I'm optimistic personally, and I think that although there is a chance that people might be a little bit more susceptible, then on the other hand, this can be balanced during the subsequent years and in the end having not much more sensitization. And there is another side, because the rate of exposure that we do have or we had in our societies until now is not necessarily the normal one, is not necessarily what the immune system is expecting. So normally, or when the immune system developed, people were not so congregated as we are today. They were not living in cities. They did not have to send their kids in the kindergarten and have 10 or 20 together in the same room and exchanging infections so much. So it is possible that this lack of infections in the first year or two might have beneficial effects. So it's a complicated aspect from the evolutionary point of view. And of course, I mentioned before that that's just the biological part that we need to look into carefully. But also we have the behavioral, the societal part, and these have changed, and this might affect the children themselves. So the social exposure, etc., is something that we need to take into account. We cannot predict, but these possibilities, both possibilities exist, and they might be both correct. So by carefully following up these cohorts, by being vigilant in seeing and monitoring these patients, we will be able to see if there are any changes, any differences, any impacts, and try to interfere, try to intervene, try to bring things and mitigate any problem.
Yes, very good. So given these potential problems of lack of exposure, particularly in the first couple of years of life, how can children with allergies and asthma help boost the immune system, so to say, given the observation that we have documented now after a couple of years of relatively lack of infections, and then they are at higher risk? Are there any possible things that parents can do in order to boost the immunity of these susceptible children, to make them more resistant to severe complications related to viral infections?
Yes, well, there are. Of course, they're easier to say than to do, but we need to understand that our immune system is trained through exposures. So we need to be very careful and try to design the optimal exposure setting. So we know some bad exposures to start with, and that's really clear. And we know about smoke, particularly tobacco smoke. Every parent should really avoid that, but also about pollution. In some cases, it's cooking inside the house with something that generates smoke. So generally, trying to avoid the pollutants and have the kids brought up in clean air is very important. On the other hand, we have the beneficial exposures, and the beneficial exposures come to a large extent from the microbiome, from microbes that live out there, and we need them. We need the stimulation so that our immune system evolves. But of course, it's a double-edged sword with the microbes, because the right quantity is something that we need, but if you get either the wrong quantity or the wrong microorganisms, you can get a disease. So what we suggest and what can be practically done is allowing or suggesting to the parents to take the kids in close to nature, go outside to be exposed to the soil, let's say, to be exposed to natural environments. And this is something that is not easily done, particularly in the urban settings. Or we can try to bring a little bit of nature closer to our cities, closer to our homes, by having small gardens or by culturing plants. This is beneficial. Of course, we have to try not to go to extremes. So we need to remember that if we don't keep the basic hygiene measures, we might get a severe infection. So we're talking about targeted hygiene, for example, trying to wash one's hands and not try to exaggerate, for example, sterilize everything. So we know that sterilization not only kills the microbes, but also destroys the skin layer and the epithelium and allows, let's say, the bad influences to come in easier. So it is this balance of the exposome, of the exposures, that can be beneficial and can train the immune system. In addition, we don't only breathe air, which is very important, but also we eat food. Food is also important. A balanced diet is something that really stimulates the immune system, including lots of fruits and vegetables, fermented foods, oily fish, and of course avoiding hypercaloric stuff. So the healthy diet as we know it is something which is also good for the immune system and against the development of allergies.
So, Nikos, very often we get to see parents these days when they come in, they would say, oh, during the pandemic, my child, with the exception of COVID, the child seems to be relatively healthy. And now he's going back to school, not wearing the mask anymore. And then he seems to be getting sick, one after another one. And they very often ask us, are we doing something wrong now? And what should I do to prevent these sort of infection to occur? Now, to me, of course, this is actually part of growing up and you're exposed to a variety of infections. The vast majority of them, yes, you get sick for a few days to a week, but they really do not have long-lasting effect on our organ system. But in fact, it appears that now we know the lack of proper exposure actually may potentially cause more long-term problems. So how would you calm down the parents as a healthcare worker to tell them it's okay to get infected every now and then?
Yeah, it is of course a $1 million question. And it depends on the specific child and the specific settings. In some cases, if the infections are mild, then we reassure the parents that having lots of mild infections is not a problem. Actually, it's good because the immune system is trained, and then after a few years, the children will resist these infections and they will not also get worse types of infections. On the other hand, if the child is sensitive and develops lower respiratory infections like pneumonia, for example, or has a lot of asthma problems, as wheezing problems, then we have to be a little bit more careful, because then we know that if you have a lot of infections, then it might in fact worsen your problem. So these children need to be protected, and the way that they are protected is through their medication. So children who have an allergy or asthma, they need to follow very closely the advice of their doctors and have optimal medication in order to reduce the effects of an infection or the risk that an infection will actually go to the lower airway or induce an exacerbation. On the other hand, we need to suggest to the parents, and this is both for the protection of their children, but mostly for the protection of the others. I think that when a child is even mildly symptomatic, it's good to have a mask, not wear it all the time because that's not good, but keeping this balance on whether you have the potential of transmitting to wear a mask. I think this is a good habit that will help the whole community to reduce the burden. So we need to reach ecologically or as a community a burden and a level of exposure to the viruses that is good for health and does not induce infections, that don't induce symptoms.
Very well said. So it's all, at the end of the day, it's a balance. It's not one way or the other. It's somewhere in between with a little bit of exposure and yet having no major, for example, as you mentioned, pneumonia. And thank you very much, Nikos. I'm sure the audience would appreciate these advice in particular. When we face with parents bringing the children and ask for what are the potential problems with the pandemic and what about the hygiene measures? And very often they would ask, should I continue to wipe my hands with alcohol, rub, and put on a mask all the time? And I think at the end of the day, we need to advise them. It's the balance approach. Yes, you need to be vigilant, of course, for some of the severe problems, but the majority of the times, these viral infections actually boost the immune system a little bit, so to say, without any long-lasting detrimental effect on the biological system. And of course, as you mentioned, the balance of exposure, both in the environment and cut down on the irritants such as tobacco smoke or air pollution. And of course, one of the most important things we need to also remember would be our diet, a variety of diet with fresh fruits and not excessive calories. All those factors will contribute to the health of the children and hopefully will minimize the risk of future allergies. And thank you very much, Nikos. And I'm sure our audience appreciate your discussion on these important questions. Thank you very much. And thank you for joining us.
Thank you very much. I think that it was a great discussion. And I do have a couple of messages for the healthcare professionals. And I think that it is important for them to realize that patients with allergy and asthma are hypersensitive to environmental factors. So we need to take extra care of them diligently, particularly during these turbulent times, both from post-COVID, but also in relation to climate change, pollution, etc. And that the effects of COVID are ongoing. It's better, rather than trying to predict what will happen, it's better to really monitor patients closely. I think that monitoring is really important, and we have to do it even better during these times. And the message for the parents and for the general public is that try to regulate exposure, try to keep a balance. Balance is really important, and you can do that by avoiding pollutants on one hand, and on the other hand, by trying to increase contacts with nature. And with that, I would like to thank you very much. It has been a really nice discussion.
Thank you.
And that concludes today's episode. Thank you for joining us with Professor Gary Wong and Professor Nikos Papadopoulos as we talked about how the pandemic shapes the future of allergies. We hope you enjoyed and learned from this discussion experts and that this will be useful for your practice.